Living in Virginia, you're in the fast lane on the information superhighway. We've invested $3 billion in Virginia's broadband network to give you one of the fastest internet connection speeds in the world, so you can build relationships, bring new business to our state, and meet the future of education. It's amazing what we can do together. Visit VCTA.com to learn how broadband connects the Commonwealth.
From the General Assembly and the City of Richmond, I'm Woody Evans for Cable Reports, brought to you by the VCTA Broadband Association and Comcast, connecting Virginians to their government. We're pleased to connect you with Delegate Ibrahim Samirah. Good to see you, sir.
Good to see you, Woody. Thanks for having us.
Now, this is your first full session in the General Assembly, correct?
Correct.
You were elected the end of last year, I believe it, and spent maybe a week or two here?
Yeah, just about 6 days in the General Assembly, just watching things happen really quickly around me and understanding what my buttons mean.
So now you've gone through crossover, which was yesterday. How are things proceeding from your perspective?
The majority is doing a great job of addressing the concerns of citizens on a wide variety of issues, whether it be from women's rights to issues that relate to our democracy and its health, to gun violence prevention, to health care, to all sorts of topics of concern, the environment being one prominent one as well. And we're proceeding in the fashion that I think our constituents wanted us to.
Talk to us a little bit about your district and your constituents.
Sure. I represent the 86th district. That's the area of Herndon. I live in the town of Herndon. I encompass the Dulles Airport and its surrounding businesses, the tech corridor, which is seen as most likely to be the next Silicon Valley of the East Coast. We have 2 metro stops opening up in the next few months. All sorts of transit, all sorts of also highways right next to us. We have the Dulles Access Road, Toll Road, and we have also Route 7. And we have I-95, 495 in particular, not too far off.
Do you serve a very diverse community?
Very diverse. About half my district is non-white, and of course the other half is white, and also very varied age groups as well, pretty evenly so, I'd say, compared to the population. The diversity of also non-whites in my district is also prevalent. It doesn't just stop at, I think, what we traditionally associate with non-white groups, which is black groups and Latino groups. But it goes into South Asian, Arab, diversity of religions. Even in those categories that I just mentioned, there's a plethora as well of diverse groups as well.
You mentioned Dulles Airport, 2 new stops. I know there's one at Wheelie Road. Is there one closer to the airport that's going to open soon?
Right. So we got a Herndon stop just for the town of Herndon, and then we have Innovation Center, which is right after that Herndon town stop, and then Dulles Airport. So we're I think the closest residential community to Dulles Airport. A lot of the people that live in my district work in the tourism industry, the travel industry in general, along with a lot of tech industry individuals and people that are living off of the tight-knit community as well that we have in Herndon that is quite dense and is really a town at the end of the day.
Do you have many people who work in D.C. for the federal government?
Oh yeah, big time, of course. All those industries overlap with the federal government. They take the train, they go into D.C. as well. Wheelie, Reston is only a 15-minute drive from the town. So, a lot of people are using the metro as is. And definitely a lot of people that work downtown and come back out. It's about, without traffic, 35 minutes to the White House. So not too bad. People are driving, but also people are taking the metro in.
I think over the last 10 years, there's been controversy around the Dulles Toll Road and the tolls that are charge people there. Is that still an ongoing dispute?
Yeah, it is an ongoing dispute. It's a issue of, are we supposed to be paying for it, or should everybody be paying for it? And that is the metro, to be specific, because that's where the money from the tolls are going to. And now that we're completing the metro, we're thinking, did we overpay? Because the idea right now is, the metro was supposed to be open a year and a half ago, but it's been heavily delayed due to labor conditions, due to the cement that was placed was not as hard as it should be. So I've been going back and forth with WMATA and then the Metropolitan Washington Airport Authority as well, which is overseeing these projects. To ask them, what could be done about that. They just came out with a fee structure that is going to be apparently permanent from now until the end of the payment of the tolls. I'm not too enthused about it, and I'm surely going to be revisiting the topic with them as well. Some of the rates that it caps at about $8.50.
$8.50.
That's that. Yes, that as part of the permanent fee structure. I think that's a bit high, especially after the metro would be completed. That being said, we're very grateful that we have a metro station. That's something that can't be said of the 95 corridor, which currently is heavily under traffic, and relative to the rest of Virginia, we're definitely getting a lot of transportation services, that's not taken lightly. But at the same time, $8.50 at the cap rate is a bit too high.
And now we have a new gas tax as part of the governor's budget to be imposed on folks. How are your constituents reacting to that?
I haven't gotten much reaction, but I think it's the right thing to do. We are not really benefiting off the gas tax anymore. That's a great thing, because that means people are moving towards electric. People are moving towards renewable trends that reduce our carbon emissions, which we need to do. Obviously, scientists are telling us that by 2030, if we don't get to carbon neutrality for our environment, then we're going to have irreparable damages by 2050, and that's something that's scary for somebody who's going to be around then. I'll be 58 then.
Hopefully you'll still be around. There's also an annual fee to be imposed on electric vehicles, I think, as part of that proposal.
Right. So the proposal is to charge drivers per mile. Now, the idea behind that is mostly because truckers and fleets in general are the ones that are driving the miles, and we want to make sure that they're paying their fair share. I think that overall the rate will be very similar to the gas tax. I wouldn't see too much of a change. And yeah, electric vehicles are definitely benefiting more than others on the road, certainly so, with the reduced need of gas. There's still a benefit to buying an electric vehicle. It's just a little bit less. We just want to make sure that we're not giving too much of an advantage for those that want to be environmentally friendly, but we also want to give them an advantage. Fairness is important.
Talk to us about the environment. I know you're passionate about that. There are several bills that have been circulated this session. Talk to us about where those are.
Sure. There was two major omnibus bills that were presented to resolve our environmental needs. The need is to get to 2030 with carbon neutrality, meaning that production and consumption of carbon in the air is at zero, net zero. And the two were the Green New Deal Act and the Virginia Clean Economy Act. Both made it out of subcommittee. One was not docketed for full committee, and the other was. Specifically, one made it out of appropriations. Both have a hefty price tag to them. One would have addressed our climate needs, and one doesn't. However, both are first steps in the right direction. I myself was very conflicted because I am the party of science. That's how I see myself as part of in the Democratic Party. I think we've always advocated as Democrats for that science should guide our policy, especially on climate. It goes all the way back to Vice President Al Gore advocating for this. This isn't anything new. And there's multiple things that need to be done in the law to make it happen. One of which is very important, which is a moratorium on the building of new fossil fuel-based plants. We need to stop trying to use fossil fuels to create our energy needs overall. If we don't do that, then we can't limit the potential for the permanent damage that scientists are referring to if we don't reach the 2030 with carbon neutrality. That was not put into the bill that passed yesterday out of the House.
Now, which one is that? Because I know Delegate Sam Rasool had the new Green
New Deal.
Right, right.
So the Green New Deal is the one that didn't pass. That's the one that would have placed a moratorium on the production of the construction of new fossil fuel-based plants. The other bill that passed out of the House was to heavily encourage the building of renewable energy resources, however, without a moratorium being placed on fossil fuel-based plants. Also, in the bill that was passed yesterday, it was basically in the language that it was within the public interest to price the production of a kilowatt at 28 cents. Now, we know from economic figures as far as how much it would cost for the average citizen to produce it, or other private entities to produce it, for that matter, would be at 8 cents. So the difference between 8 and 28 is quite significant. So basically what we are doing here is we are trying to convince with this bill in a very desperate fashion our energy companies to change course for more profit than what they are making right now off of the production of fossil fuel-based energy, which I think is not the right approach. We're trying to save the environment, but it's for economic justice first and foremost. We want people in rural areas, we want people that are poor to benefit off of our wind, our sun. All these renewable resources, these resources that are available to us as humans living on Earth. We shouldn't be pricing it so high for something that is so readily available. So when we can't come to that consensus that the price should not be as high as extracting oil from the Earth and pumping it out into pipelines and then processing it into plants, then we're doing ourselves a disfavor. We shouldn't be getting to that point. We should be thinking about how we can do it the right way. That's why it's being phrased as a New Deal, because energy is probably our most precious resource that we have as the United States of America at a national level. Unfortunately, we've gone to wars for it. And have shed a lot of blood on Earth for this energy. Again, all this shouldn't be the case. We should be using our might and force to have this energy available to us with no damage whatsoever to anybody, period.
Is there a Senate version of the Green New Deal at all?
Nope, there is not. So yesterday on the vote, I made a very tough decision to abstain from the vote. I didn't vote for or against because I do believe that we should move in that direction of increasing renewable energy and getting closer to that zero carbon emission net zero carbon emission by 2030. However, do I think that that was the plan that we should have came up with? No. Do I think ratepayers should be paying an average of, according to the Attorney General's office, which testified in the Senate against the Virginia Clean Economy Act, at $23 per month on average, each constituent will be paying more? I don't think that's the way to go about it. I don't think that we should be putting the brunt of the environmental problems on the backs of everyday people who just were driving their car. It's these fossil fuel-based companies that have been doing the destruction to our environment, and they're the ones that should be recognizing that and not putting, and recognizing that their share of profit should be reduced as a result.
So I take it this is a significant disappointment for you because it not only relates to the health of the planet, but you're a doctor by background and training, relates to the health of humanity as well. Absolutely.
I think that the environment is public health. Public health is very important. We are coming to conclusions more and more today that your health is not just related to your bodily health, the physical elements of health, but it also relates to the environment around you, whether it be the literal environment that we were referring to here with your air, your water, or be it how you get to work, where you live, how well your family is doing, and of course, how good your health insurance is. Not to forget that your bodily health is important also in this. Is it costly for you to get health care? Is the health care that you're getting right now higher quality or lower quality? Are you underinsured? Are you paying too much as part of your health insurance plan? Statistics across the board will say that people are overpaying, and also that we have 11% of our population that is not insured, and that affects us all.
And of course, that's even with the expansion of Medicaid that occurred here recently.
Correct. I think that Medicaid expansion was a great move in the right direction, obviously, picking up those federally matched dollars to benefit our everyday people, to boost our healthcare system, to make it more lively, to have more individuals being covered at hospitals. Of course, that's very important. But that hasn't solved the problem for my part of Virginia. In Northern Virginia, the average income is extremely high, and the Medicaid expansion was based off of the federal poverty line to cover people up to 138% of the federal poverty line. That doesn't cover many people in Northern Virginia because of the high level of income. And so that means people that are in poverty in Northern Virginia have a much higher income level than 138%. All in all, I don't think I'm pretty certain that we did not benefit from Medicaid expansion dollars in Northern Virginia. Our problem in Northern Virginia with regards to healthcare costs has to do with the fact that there's no competition in the marketplace with private health insurers, who generally speaking are on the same page about keeping the rates very high, the cost of getting insurance very high. And the same goes for our hospital industry, and as well as our doctors. I'm a doctor myself, and I will say that we charge a lot.
Do you think the creation of a state health exchange will help people in that regard?
The state health exchange will save the state money, because we do have administrative fees that we pay when we have a federal exchange. So we need to be able to serve as many people as we can with our state dollars, and that means if we administer it ourselves and save money on administration fees, then that can help.
As you know, as a practicing dentist, Medicaid, generally speaking, does not cover the cost of dental care. Every year, people go to the remote access clinic in Southwest Virginia. Dental care is very important. How do we address that issue?
It's a mixed bag of solutions. It has to do with reimbursement rates. It has to do with also just, again, the private insurance market being so tough to crack through. That there's a symbiotic relationship right now at play between private insurers and dentists. Dentists want to see the patients that pay more, simply put, and there's also not enough dentists out there to cover the population as well. So it's a multifaceted problem. We need more dentists, meaning we need more dental schools. We also need to have higher reimbursement rates on the Medicaid and Medicare programs. We also need to just add them, period, as options on the Medicaid, Medicare programs. We need to also start thinking about which dental problems need the most focus, which ones are the best bang for the buck. We need to be able to focus on the reimbursement rates to tweak them to match the needs of our society. I think a lot about our elderly population in this category, people that have a few teeth left in their mouth and could use a denture. I think that is a huge solution that could be had for all sorts of cancers that have to do with your digestive system. We could do tremendous benefit to our systems by adding dentures to our plans, extractions obviously to remove the remaining teeth. And for children, we need to be focusing on preventative programs. The best type of dentist out there is the one that prevents you from getting a cavity to start with, one that teaches you how to take care of your oral hygiene rather than just give you fillings and crowns and root canals. So we need to be focusing on that level of preventative services, and for the elderly population on giving them teeth.
And of course, in order to get more dentists into the marketplace, you're talking about taking advantage of higher education, which has become more and more expensive, as you know, and student debt is a real problem. I know that's a passion of yours as well.
Yes, I have about $560,000 in loans right now.
$500,000.
Over half, yes, and it's counting. And I think I'm part of my generation, which went to private universities, got our best education because that's the right thing to do, to be able to empower ourselves in the marketplace of jobs. Some of us but want to follow some other passion, some other field. I went into public service. My salary right now is $17,800 a year. That's certainly a fraction of what I'd be making as a dentist. However, is this the right thing to do? Yes. Does society need public service? Absolutely. So I put that kind of logic to the side as far as having to repay my debt. But it's a big problem for a lot of people out there in the world who need to live, but also need to pay back their debt. And also this debt problem is growing on a federal level to tremendous heights. And a lot of people are going to end up defaulting. And this is going to be a crisis of our times. We just simply are unwilling to acknowledge it right now.
And of course, many youngsters don't need to go to college. And there's been more of a focus on career education training. Talk to us about that.
Yeah. So we are very focused in Northern Virginia on our community college system there, the Nova Community College. And we're doing our best to create those pathways, those technical career pathways. So we came up with this year with the governor's office, the G3 program, which basically tells students to come on in, learn a technical skill, also get money to live, and also just money to spend on themselves and their education, of course. And I think that's going to be a very powerful program. We need it, especially with all these businesses being very attracted to our specific geographic location and our amenities, like Amazon. Google's next. All these different big companies are going to be coming through. Like I mentioned earlier, especially in my district, we're really hopeful that we'll become the Silicon Valley of the East Coast, and that requires us to provide technical career pathways. So that is a pathway that we're working on very closely, also with George Mason University, to allow students to trickle through the community college system, and then so to save that money on the initial courses that every student takes, and to finish off their college degree at George Mason University. So we're trying to utilize our whole public school system to be more effective and cheaper. In-state tuition rates are affordable these days.
I believe that Triple G program also has a component of community service.
It does. So we expect students to also come in and also give back to the community as a result as well, to create public servants. I mean, it's highly needed profession. It doesn't get paid well. We need more people involved there. And this is, I also forgot to mention earlier that I do also represent Loudoun County as well. I represent Sterling Park. I have 2 precincts there. They have very similar problems as well as to Herndon, and so I think a lot of it relates. Route 7 is a big deal for them, and
Yes.
we're happy to be expanding it this year.
Great. Now, what about any specific pieces of legislation that you have pursued to this point?
Yeah, I definitely pushed on the healthcare policy element this year, trying to put in place a public option that's administered by the private sector to try to create new competition for private insurers using private administrators like themselves. We call them MCOs, and that didn't make it through. I tried to study the costs of covering every other individual that's not covered currently in our healthcare system. Also, that bill didn't go through. I tried my best to put insurance open enrollment for pregnant individuals upon their certification of pregnancy in the Affordable Care Act marketplace. That also didn't go through. We still have a ways to go with regards to pushing against the interests at play in the healthcare industry to recognize that this is a serious problem that needs to be resolved, and that they are they're a huge part of the solution and the problem as it currently stands.
I guess that same thing relates to surprise billing, for example.
Absolutely. Surprise billing this year, we came to an agreement as far as how to deal with it. And there's a bill that Delegate Mark Sickles is carrying, and we just passed out yesterday. Hopefully that will resolve a lot of the issues with surprise billing.
Now, how does that work? Because I know it takes the consumer out of the picture. The consumer or the patient would no longer be responsible for those additional costs. Who's going to bear those costs under that bill that passed?
Well, we have huge healthcare systems that have a lot of money. And one of them is the two of which are Samirah and Inova. They cover a big part of Virginia's hospital systems. Samirah has about $3 billion in their coffers. Inova has about $1.5 billion. They're both considered nonprofits under the tax coding system, and they certainly understand that it's better for them to cover people to get what they can out of the health insurance plans that patients have, rather than get nothing. And so, especially in these tight situations where people really need to be provided health care in very extreme situations, situations where people are going into the emergency room, they needed to resolve the issue. And so they resolved it, I believe, by reducing the costs of emergency visits to the hospital. I think that was one big avenue of it. At the end of the day, people like myself, I've gone as a 19-year-old to the hospital, to the ER, for something that I thought was a really big deal, but turned out to be something that was to be resolved with a little bit of medication, and ending up paying about $1,200 as a 19-year-old in college. That was half of the amount of money that I had for discretionary spending.
Great. We'll have to leave it there. Thank you for being here. We really appreciate your time.
Absolutely. Thanks, Woody. I appreciate it.
Thank you for watching Cable Reports, brought to you by the VCTA Broadband Association and Comcast. Until next time, I am Woody Evans.
Mm-hmm.